Habiba Ali Maalim, nominee for the Executive Committee, member for Health, today appeared before the Committee on Appointments, led by its chair, the Speaker of the County Assembly of Wajir, at Assembly Chambers around 12 noon. Throughout the 35-minute grilling, Mrs. Habiba responded to the MCA's questions with a great degree of composure, leaving no doubt about her suitability for the post. Governor Ahmed Abdullahi has headhunted Habiba from the Somalia state of Jubaland, where she was working for an international organization. She holds a master's degree in reproductive health from the University of Nairobi and Bachelor of Science in Nursing from the Kenya Methodist University. Mrs. Habiba, creme de la creme academician, unveils her rich working experience in both public, private and international humanitarian sectors, spanning over 20 years in health sector. Her immediate past job was with an Irish organization, which she served as nursing services manager in entire Gedo region in Somalia.
My name is Habiba Ali Maalim. I'm a nurse by profession. I was born and brought up in Wajir County. I attended primary level in Buna. I studied my high school in Wajir Girls High School. I hold a master's degree in reproductive health, graduated from University of Nairobi. I also hold Bachelor of Science in Nursing, graduated from Kenya Methodist University in Meru. I also hold Diploma in Nursing, graduated from Kenya Medical Training College, Embu. Regarding my work experience, I've worked both in public and private sector. In public sector, I've worked in Wajir Hospital as a hands-on nurse for a period of 6 years. I've also worked in Garissa Provincial Hospital. By then it was a provincial hospital for a period of 4 years. I've also worked at national level, that is in Mbagadi Hospital in Nairobi City County, for a period of 8 years at managerial level. I was coordinating nursing services activity in the entire facility. And I've also worked in Somalia with the Irish organization, Trokra, as nursing services manager, where I was coordinating all nursing activity in the entire Gedo region.
After the introduction session, the committee members asked Mrs. Habiba how she will address the huge pending bills she's inheriting from the previous administration and how she will solve the predicament. She pledged before the committee that she will do something to have the matter resolved amicably, promising to work closely with Governor Ahmed Abdullahi. Since she is well versed with the donors, the Health CEC nominee promised to reach out to the different donors to fund many projects that are vital to Wajir people.
Regarding the pending bill, I was told that the pending bill of my docket is around 1.3 billion. When I go in, probably after being sworn in, the first thing is that I need to have meeting with the chief officers, the outgoing chief officers, because they understand the sector before more than me, since I'm new. So I get to know what is there. And as a policy maker, as a CEC Health, I'm going to prioritize in payment of the pending bill, because if the pending bill is 1.3 billion, and I say that the first year when I came in, I'll offset the entire bill, so I don't have anything to run with the entire health sector.
When she was asked the status of the sub-county hospitals, the agenda and the strategy she has for the hospitals, Ms. Habiba unveiled the tactics she will use to fully operationalize all the health centers and pledged to prioritize every Wajirian and other Kenyans for their good health.
According to SDGs, Sustainable Development Goals, every individual is entitled to a good health. So we must make sure that we equip all our health facilities. And when I came in, As a CEC, one of my plans is to sit down with the stakeholders, try to source for funds, and see where I can be able to bridge the gaps. And then I'll also do meetings with my chief officers, with the relevant authorities, including the directors, the departmental unit, with also the governor, and see whether we can be able to bridge the gaps in terms of making sure that we achieve the universal health goal for the people of Wajir. And the other one is that I need to do a baseline survey for Wajir County Hospital, for sub-county hospitals, so that I'll be able to know where the challenges are. Once I understand the challenges that the health sector is facing, now I'll try to source for funds. And then there are some critical things that we must have in place always. I'll make sure that we prioritize when we do our budgeting. We prioritize, we ensure that the facilities have essential medicines. We ensure that our critical services, like the emergency response, are working well, and I'll ensure that we have buffer stock. Buffer stock is a backup for in case we get shortages, we must have a backup, so that in case of epidemics, in case of an outbreak, we will be able to go back to your source and see whether we can tackle.
The committee expressed concern with power blackout, which has impacted negatively on service at Wajir County Referral Hospital, and asked what remedial measures she will put in place. The CEC nominee promised to create an alternative power source in future using solar system that will solve all issues related to power blackout.
Once I go into the office, I need to assess the current supply source of power for all the facilities, including our county referral hospital and the sub-county. Once I assess, I need to take it up with a relevant authority, that is Kenya Power and Lighting, and inform them that power is very important, because like in Wajir County, we do cesarean section and so on. So at any one time, we must have a power. So I'll try to liaise with them and ensure that the power is available for all our health facilities. And number two, I need to have a mechanism in a way that we have a backup method, so that in an event that there's no power, we indulge ourselves to backup system, including, for example, we need to have a generator for example, in Wajir County Referral Hospital, because that is where the bulk of patient comes. So at least a backup must be there to enable the critical services not to be interrupted. Another way that we can do is that Wajir is a sunny place, so we can tap the potentiality in it by installing a solar system in our facility. Once we are done with the county referral hospital, I cascade the same agenda or the same opportunity to other sub-county hospitals and ensure that we have a solar.
On matters regarding the state of the ambulances, on the unverified reports that the members of the public have to fuel the vehicle and pay per diem to the driver, Madam Habiba promised a consultative leadership, maintaining authority to give direction on such matters related to the ambulance services.
When I go in an area that I will instill a lot of professionalism is the issue of ambulance. And I must provide the leadership to ensure that ambulances are made free of charge to the people of Wajir County. Because there are set rules, there are set regulations, there are SOPs, standard operating procedures for the ambulances, and everyone should know that ambulances are free of charge and should follow the protocol. And then the other thing I will do is that we normally have emergency response unit Where I used to work, there's an emergency response department. Probably, maybe it is also available in Wajir County. I make sure that the person who is coordinating the referrals, the person who is coordinating the emergency department should ensure that ambulances are used for the work that is intended. And the other thing is that I need to come up with a system called feedback complaint mechanism, where I provide a hotlines line. Especially, I'll probably start with Wajir County, with the Wajir County Referral Hospital, provide a hotline so that in case there are complaints, in case there are issues in the public, they call that number, and we account the person who maybe probably have offended the mistake.